and welcome to the Telehealth Daily Brew. I'm Sean Elwell. Telehealth is a dynamic topic. Laws, technologies, adoption patterns, and use cases are constantly evolving. Telehealth now involves some of the world's largest companies. In each episode, we'll dig deep into one telehealth topic with the perspective of someone who's been active in the field for a long time. You'll find links and content supporting this podcast online at www.care.it. Today is February 12th, 2019, and this is the Telehealth Morning Brew. I'm here with Accenture's Brian Kalis, and we're going to talk a little bit about how Accenture is supporting healthcare IT innovation and perhaps dig deep into Brian's particular specialty of digital engagement. So, Brian, welcome. Good morning. And
Good morning, Sean.
Good to see you. And we've got a short little time slot, so I'll jump right into it. Maybe just give us a little overview on how Accenture sees itself supporting the healthcare IT industry in general, sort of the 30,000-foot view on how Accenture is approaching the healthcare IT industry.
Yep. So Accenture provides a full set of services to the healthcare system across both health systems, health plans, as well as other health services and technology companies. And with that, we provide a full set of services both from front office services that actually work directly with consumers and patients, as well as frontline services for clinicians and other support staff, and as well as back office services. So we really look end to end about the entire ecosystem. In the area of digital health and innovation, we're really looking at what are those emerging technologies and business models that can come together to address some of the industry's biggest challenges, including both consumer experience and better outcomes, as well as really making significant improvements in labor productivity to improve the cost equation of care.
All right, so everyone's trying to figure out how to engage the patient digitally. I think we figured out how to do that in the bricks and mortar world a long time ago, and that's constantly making small incremental changes. But we're in the sort of really trying to figure it out stage, I think, with the digital engagement realm. So what are some of the philosophical things that work in digital engagement that you're seeing and you're trying to promote to those who are trying to improve their digital engagement?
Yep. As you stated, John, we are at the early stage of kind of the digital health evolution within the healthcare industry. Interestingly, we're really seeing it now move from something that was a very cottage industry to now something that's more mainstream. Last year, a consumer survey we conducted identified that really digital health now is moving from something that was cottage to now more mainstream, where a majority of health consumers were using some form of technology to manage their health and health care. Now, what you're trying to see is now how does the overall system catch up and start to meet those different needs that people have of how they want to use technology to engage with the healthcare system. Right now, there are a number of, I'd say, signals of success, and a lot of those signals happen at moments across a consumer's healthcare journey. So you'll see, for example, success in providing online bill pay solutions that simplify the bill and allow people to pay online, whether it's through a mobile phone or desktop, and which for the individual provides simplicity and convenience, as well as for the health system helps with collection, as an example. On the front, you often see that with access as well. So the ability to put online appointment scheduling is really meeting people's expectations for convenience and simplicity, yet also is helping health systems with acquiring new patients and actually bringing them into the front door. However, we're still in early stages of stitching all those things together. So you see engagements on each of these points. The real challenge is how do you actually weave that together in a system and connect it with the traditional bricks and mortar type of care that we've seen.
Yeah, so I think the way you and I first met was a self-critical, nameless, integrated delivery system who looked at what they were doing and said, we need to do better. Yep. I would say that Accenture is somewhat in the fix-it business, trying to help people fix their digital experience and make it better, understand what philosophies they need to bring to bear to improve their digital engagement efforts. So what are some of the fixes you see? What are some of the problems you see in terms of the things not to repeat, things to improve upon? What are some of the things that folks are doing and looking and saying, this stinks, we want to get better at it? And what are, maybe just shine the light on the problems that need to be solved.
Yeah, there are a number of different challenges that need to be solved when facing adding digital and digital engagement and digital change. One of this is, starting at the top, is leadership. It really takes leadership at the top to actually drive change from the top down, because it goes counter to so many things about how health systems and health plans have been organized historically. That leadership then feeds into culture. So digital itself is an environment of rapid change, both of technologies, consumer preferences, as well as the need to get different types of services and experiences out fast. That's very different than how the healthcare system has worked historically, of slow evolutionary progress with evidence. Now that background also has a lot of good things. There's a lot of reasons why that's in place to ensure quality and safety for both patients and clinicians. So it's how do you actually address that cultural divide? Third would be structure. So a lot of organizations are structured in silos today. So you have a marketing team, you have a clinical team, you have a call center. All of those are individual things that have individual budgets. But in the digital world, you need all those things to work together as a system. And you need cross-functional teams to come together to try to address those changes. So those three things combined really need to be addressed to actually start to get systemic change and move beyond just point solutions and, I'd say, signals of success like you see today.
Yeah. One thing that I see repeatedly is where to put it in terms of who's got the ball when it comes to digital engagement. You've got marketing folks who typically, they're good at that. They understand the consumer. They think a lot about the consumer. They think about branding and messaging. So they have some skills that are necessary, but they typically don't have the technical wherewithal and the budgets to take over digital engagement. So sometimes it ends up with marketing. Often it doesn't stay there long. Sometimes it ends up in IT. Those guys are really good with technology, typically really bad with understanding patients and delighting patients and consumers. So that's an imperfect place. Sometimes the delivery system wants to take over and say, those are our patients. We want to engage with them. You know, we know all about patients. They typically are weak in some of the messaging, branding, and technology side of things. That isn't really their skill set. So I could go on with all the places it could live. And I think one of the reasons health systems and integrated delivery systems wrestle with this engagement thing is who's got the ball. And there's lots of ways to cut it. And I think they often get stuck right there with not understanding where to put the task. So maybe you've got some thoughts on that. I'm sure you've seen as many incarnations as there are out there.
Yeah. To comment first on your point, we do see there is an increasing thing that we saw from outside of industry happening in healthcare, and that is the CMO, so the Chief Marketing Officer, and the CIO, Chief Information Officer, divide. And there is really this need for the two to come together. So as marketing has moved heavily into technology, and technology has moved into marketing, there is this blurring of lines and a new type of collaboration that's needed across those two. Structurally, you are seeing a lot of organizations create dedicated digital organizations that break those silos down, that bring the best of marketing, technology, plus strategy all into one organization with operations. That can sit both in the core or outside the core in terms of options. And both of them have pros and cons, so there's no one right answer on those. It's just a lot of that's organization specific. To your point on leadership, another organizational specific consideration there is, well, where do you put it? And that really comes down to, well, what type of person and leadership team structure do you have? In some cases, you see a strong CIO that actually has more of a strategic bent versus an efficiency bent. So a growth-oriented CIO can sometimes take that role. On the marketing side, sometimes you have a marketing lead that actually will have a fair amount of tech savvy and be aware of all the different ways that engagement can happen across a consumer, and that will lead. You'll also see the emergence of a chief experience officer. Some of those will come in and play the role and operate across silos. So to your point, structurally, we're seeing a lot of variation about where it can sit. A lot of it comes down to, where does that right type of skill set fit in your organization and what's right for where you want to go.
It sounds like that you don't see a magic answer. It really comes down to the personalities involved and the leadership involved, which is it's not a tidy little answer, but I guess it's the answer that we have. We're running out of time. I just wanted to ask one more question, a visionary question, because I think Accenture has got a great vantage point, sort of looking on top of the industry, and works across multiple vendors. Everyone's talking about AI. There's smart chatbots coming up. There's clinical decision support software. We've got IBM Watson, who's doing all sorts of fun things. So everyone knows that AI is coming, but not everybody knows how to prepare for it, because it still remains, I think, still a solution of the future to some degree. The AI offerings are still early stage, I would say, but we all need to be ready for it. And what does that mean to be ready for it? So if you're trying to construct digital engagement today and spend your money today, how do we do it in such a way that we're not sort of stumbling over ourselves tomorrow when some of these capabilities really become mature? So what are you saying to that?
Yeah. So we're at a unique point where there's a convergence of so many different disruptive technologies or exponential technologies, whether it's artificial intelligence, mobility, cloud, you name the type of solution, all coming together at once. And because of that, it almost causes us to go back to first principles. And it really comes down to, well, what business problem are you trying to solve and why? And I think the easiest thing to do in any of these situations is to actually step back and think of that, and then figure out how can you solve it differently. The good news is, whether it's with artificial intelligence or other solutions, we likely have the tools now to put them all together at scale and at low cost. But we often get stuck in a specific technology phrase or category, which can prevent it going, well, really this is about people and how we actually can provide care. So we'll figure out what are those problems, and let's back in to how we can do that.
Well, great. Well, Brian, I hate to cut it off there, but we're going to get kicked out of this space pretty soon. I appreciate you coming in. I think this will be a strong episode of the Telehealth Morning Brew. Thank you.
That's good. Thanks, Sean.